Welcome to the applicant webinar for the Robert Wood Johnson Foundation's Systems for Action Research Program. This virtual webinar or workshop is designed for people who are considering applying for the next round of funding from the Systems for Action Research Program. My name is Glenn Mays. I'm a professor here at the Colorado School of Public Health, and for the last 5 years I have had the privilege of directing the National Program Office and the National Coordinating Center for the Systems for Action Research Program. I want to tell you a little bit about the program first, and then tell you a little bit about what you will encounter in the rest of this virtual workshop. Systems for Action is a signature research program of the Robert Wood Johnson Foundation. It was launched about 4 years ago as part of the Foundation's Culture of Health Strategy, Culture of Health Action Framework. And Systems for Action is one of a small number of research programs that are designed to build evidence for how to realize the goals of the Culture of Health Action Framework, how to ensure that, in particular, our healthcare systems and public health systems and our social service systems are aligned productively in ways that can support improved health and health equity for the American population. We know that when we look at the major determinants of health and well-being, those factors include, but they extend well beyond the medical care system to include the work that we do in public health agencies and programs around the country. And importantly, they include the work that our social services and support systems across the country provide as well, and looking at factors like transportation, housing, food security, ways of supporting income and employment, the educational systems, and many other aspects of our social and community environments that connect to health and well-being. The Systems for Action program is designed to conduct rigorous research to tell us what strategies are most effective in productively aligning, connecting, and integrating medical care systems with public health systems and the constellation of social service systems in ways that can support health and well-being and achieve health equity. That's fundamentally what our research program is about. As you consider opportunities for applying for funding from our program, there are a number of important aspects of the program to keep in mind. First of all, our Systems for Action is focused on 3 broad types of sectors and bringing those sectors into closer alignment: the medical care sector, the public health sector, and the social services sector, broadly defined. So your research program, your research proposal needs to explicitly test ways of connecting those 3 broad sectors: medical care, public health, and social services. Secondly, it's important to recognize that in applying to this program, this is a research program. So fundamentally, we're designed to produce strong scientific evidence about strategies that are effective in connecting medical, social, and public health systems. So your application needs to identify a specific mechanism for aligning and connecting those 3 broad sectors, what we call a system alignment mechanism. And we're looking for innovative system alignment mechanisms. We're looking for proposals that can break new ground and provide new evidence about what works to connect these types of systems. Thirdly, very importantly to our program, our program is called Systems for Action for a reason. That second and third word are very important to our program. We're a research program. We're producing scientific evidence, but it's evidence designed to be acted upon. And so we're looking for applications that explicitly have ways of moving findings into the hands of stakeholders that can can implement those findings, that can act on the research results to actually align health and social systems in real-world communities. So your project needs to have connections to stakeholders, to real-world stakeholders who are working in medical care and public health and social service systems. Those stakeholders need to be intimately involved in your project and in the research as it plays out during your project. And those stakeholders need to be, your project needs to have active ways of disseminating and translating the evidence to stakeholders and supporting stakeholders in using that evidence in the real world to align systems. So in a nutshell, that's what our program is about. In the rest of this workshop, you're going to hear from real research teams that have successfully developed applications for our Systems for Action program and have successfully secured funding for those programs. And these applicants are going to be sharing with you the strategies that they used specifically in developing their applications. Where did their research idea come from? How did they figure out what kinds of stakeholders in medical care, public health, and social services to engage? How did they engage those stakeholders and keep them interested at the table? How did they come up with their research design that would be both rigorous as well as feasible and relevant to real-world communities? How did they figure out how to navigate and deal with the narrow, the limited time frame they have to implement their projects and the limited budget that's available to support their research? You're going to hear the applicants talk about those kind of issues. And then finally, you're going to hear applicants talk about the strategies they designed in their applications for engaging stakeholders in the translation and implementation of research findings and how they are supporting real-world stakeholders in implementing the system alignment strategies that their projects are testing. I can tell you that you're in for a real treat in hearing from a variety of stakeholders all across the country who are now successfully implementing their Systems for Action research projects. And hopefully the insight they share with you will be helpful to you as you look to develop and submit your application for the next round of funding in our program. Thank you so much.
The Robert Wood Johnson Foundation focus on multi-sector determinants of health and alignment mechanisms is a very innovative and important area of inquiry. And we considered the factors that you and the RWJF have been developing with respect to multi-sector coordination. And we identified what we felt was one of the biggest multi-sector issues, which is to improve the health of a population and health equity. And those issues are care fragmentation and conflicting financing mechanisms, which are related to each other. And in order to test our ideas and the mechanisms that we felt were important, we identified behavioral health, because behavioral health is highly fragmented, especially between the healthcare system, public safety, emergency response, and social services. Mm-hmm. And in that context, the conflicting financing mechanisms drive a lot of the care and lack of care that this high-risk population receives. So that's how we originally, we felt that area is a really important area to improve population health, but it's also emblematic of the fragmentation and financing problems that we have in the healthcare system.
So I've been doing research on the experience of food insecurity and hunger for a couple of decades. And one thing that we were learning is that people who are poor are really caught up in the silos of our public assistance systems, or what people consider to be, or they talk about as if it's a safety net, but it really is not. And what we've recognized through our qualitative and quantitative research is that the systems don't talk to each other. And I had already carried out a randomized controlled trial on this intervention that we call the Building Wealth and Health Network. We call it the Network for Change. And we were actually able to show that we were able to help people reduce their depression and increase their economic security. We wanted to work with people who are on cash welfare, or TANF, that's called Temporary Assistance for Needy Families. But that program only focuses on education and training, and yet we knew through our other research that mental health and behavioral health was actually really important, and that there were many unaddressed issues associated with trauma that were getting in the way of education and training and on the success of TANF. So in the randomized controlled trial, we found this intervention that worked, and what we wanted to do was find a way to slowly get it into the systems, our public safety net, to be able to help improve TANF itself, but also we knew it was going to reduce depression because we'd actually been able to show it. What we wanted to do was find a way to convince the people who are in control of Medicaid dollars to see TANF as a really important program that could actually help people reduce their depression, but also we wanted people in TANF to recognize the behavioral health components.
Over the last few years, I've been lucky enough to be able to collaborate with a team with investigators at the University of Rochester, and also from members in the community in the Rochester area. Although I live in New York City, it so happens that several projects came about in that region. And one of the organizations that we work with doing evaluation work is called Lifespan of Greater Rochester. And they basically coordinate the provision of social services. And they're doing it in a very unique way because they're coordinating or making referrals for social services within the healthcare delivery system, having a social worker or a coordinator inside a clinic. So we did that work. They were funded by the state to do some of that work, to provide services to the local population of elder adults. And that basically allowed us to learn a lot about how they operated, how they partner with other organizations that had data, for example, on hospitalizations, emergency department visits. So we were able to assess, if you participate in a program, what happened, what was your pattern of healthcare utilization before you participated or obtained services from Lifespan, and after.
I'm part of a larger team here at Ohio State that's working very closely with the Public Children's Services Association of Ohio, which is PCSAO. They're one of our partners on this project, and they represent the 85 public county-based child welfare agencies in the state. And we had been working with them to design an evaluation of the Ohio START project. And START stands for Sobriety, Treatment, and Recovery Teams. It's a child welfare-based model that's intended to help identify parents who come into the system because of substance use issues and quickly connect them with substance use treatment services, and then provide a wraparound care support and really integrate both substance use and child welfare services. So being part of that evaluation team and being able to see, the first 17 counties implement the model, we learned a lot from that. And the idea for the project actually came about, I was sitting with my partners at PCSAO and other partners at the Ohio Association of County Behavioral Health Authorities, which represents the 58 county behavioral health authorities in the state. We're really about local home rule here in Ohio, so all responsibilities are diffused to the county or regional level. So we were actually having a meeting between these two groups talking about local responses to the opioid crisis here in the state, talking about the START project and other ways to further integrate behavioral health and child welfare services. And Sherry Walter, who is the executive director of the Ohio Association of County Behavioral Health Authorities, kept talking about, these ADAMH boards, the alcohol, drug addiction, and mental health boards in these local areas, they can really help play a role in aligning child welfare and substance use treatment services in these local communities, because they understand the landscape, they understand the need, they understand what providers are out there, and can help start to make connections and coordinate those efforts, both between child welfare and substance use and with the larger behavioral health community's response to the opioid crisis. And so that started to get the wheels turning a little bit about, oh, there's a research question there about the role of these county behavioral health boards and the mechanisms that they're using to help align services across different systems.
So the project for which I was the co-PI was an evaluation of Housing for Health, which is an initiative in Los Angeles County that provides permanent supportive housing to individuals who are high utilizers of healthcare services provided by the county. And the initiative itself is multisectoral in nature. I mean, they identify individuals who are high users of healthcare systems, but those individuals usually, and who are homeless, and those individuals usually have complex needs and comorbidities that require the involvement of multiple sectors in the county. So the program connects them to services provided by multiple departments, social services, public health services, obviously housing, healthcare services, mental health services. And they created a centralized system that the different components of permanent supportive housing, which are usually managed independently and without any clear oversight or any central sort of system that is tracking who's doing what and making sure that people are doing their job properly. So Housing for Health created the system that administers everything under a centralized staff, and also with centralized funding, which is also one of the other problems, that when you have permanent supportive housing systems, case managers often spend a lot of time chasing money rather than actually providing services for their clients. Whereas in Housing for Health, the money is already dedicated. And once you're a client of Housing for Health, you already have the funding necessary to get you housing, the subsidies for rental, and also the supportive services for the case management services as a result of the program. So our study is essentially an evaluation of, does this centralized system, the centralized approach to implementing permanent supportive housing, does it work better than the more decentralized, uncoordinated approach that we see is, that's sort of the norm pretty much everywhere else. It was fascinating, and I have to say, the creation of Systems for Action came at the perfect time for us, because it's when we identified this program, which is multidisciplinary in nature. It crosses all these different sectors, obviously social services, public health, healthcare services, but even broader, I mean, also the housing in particular, mental health. The opportunity of analyzing this, focusing on the system level impacts and the synergies that are created by linking, people to all these different services at the same time. It's something that may have been difficult to frame it for other funding opportunities, but in this particular case, it fit Systems for Action really well, and so we were really lucky that we had this idea at just the right time when you guys were created.
I would say that several of the members on our internal ASU research team are very well connected with the community here in Arizona, and so knew right away who would be integral to this project. But in addition to that, in our first series of meetings, and actually throughout the entirety of the project, we would continually ask who is missing at the table, what stakeholders in the community should be here to help enrich this conversation. And that's really kind of what helped diversify all the people that were in the room, was having it be stakeholder-led and driven, having them guide us.
Well, we had already worked very well with the program participants and people who were administrators in TANF. What we had not done was work with people who do Medicaid and Medicaid reimbursement. So on the healthcare side, we hadn't engaged those state stakeholders very well. So how did we bring in the right stakeholders? We knew that we needed to bring in the stakeholders that had a special affinity for the project itself. And that was, so we had already had the state administrators who run TANF. It turns out that in the state of Pennsylvania, the Department of Human Services they also oversee Medicaid. So they oversee Medicaid and TANF, and yet, but those are under, like the managing administrators don't really communicate very much with each other. So we had a few high-level meetings and phone calls and asked the people who work on TANF, who should we involve with Medicaid? And then we told them about our project and they got very excited about it. And I think that one of the most important things is when you're looking for good stakeholders is that you don't just go for the big names or the top official. You go for the people who have been in the system for a while or in the systems for a while, who have a strong feeling and affinity for the project and for the work that you want to accomplish.
Basically, because once you have a sense of what is it that you want to study, then the way that I tend to break down those problems is I think about who's going to be the best person to do each component of the project. Many times we think that when we do anything that is science, research, or evaluation, we tend to try to do it all. Mm-hmm. And what helps, I think, is to think about your strengths and then think about what other people can bring to the table. So
we certainly had the benefit of having that head start, being part of the evaluation team with PCSAO for the child welfare side. I had also done a little bit of work previously with the Ohio Association of County Behavioral Health Authorities. So I think our team definitely benefited from existing relationships that we were, and the two entities, the County Behavioral Health Authorities and PCSAO, they have also had a history of working together. So we weren't engaging brand new partners in this instance. We were really aligning folks in a new way to address these new research questions.
I think we figured that one of the questions you might have might be, how non-university entities may be successful in these proposals, and that's something that I think may be an advantage for us. We're the county; we have access to the data, to the service provision data, especially, and we have access to the decision makers. So that's definitely something that I think if we can encourage other non-university entities to also submit proposals for this kind of research projects, I think that they can be successful.
Yeah, I think probably the traditional way in which a government agency gets involved in a project like this, or for funding from Robert Wood Johnson or similar organizations, is by having an academic organization take the lead and then involve the government organization sort of to support and showcase the value of the project. I think we were very deliberate in thinking we can take the lead on this. And like Irene said, in LA County, we've been striving to build the analytical capacity to do this kind of work that we feel confident this is something we can handle. And also, obviously, being part of the county system, we understand the data that is available to these projects. We understand where this project fits within the overall policy agenda for the county. And both of our projects have very, very multidisciplinary nature, they cross over multiple sectors, but all of those sectors in one way or another have county agencies involved in. And so, I think we certainly wanted to submit projects where we were taking the lead, which also we believe makes it more likely that we will get the ears of the right decision makers.
I think it's important to build off of a program or a type of research studies where you already have some really good content. And so since it's a research type of a mechanism, it's important to not build too much of program into the proposal itself. It's to really focus on the research, but you have to have a strong program or strong content already so that you don't spend too much time focusing on the program and not on the research.
And then they get also, because it has to be a win-win. Otherwise, like, I don't want to get into a project with an organization that has no value to them. So a lot of the work is basically, do you think, what are the questions that you're interested in answering? And then from that, you sort of like find some sort of convergence point of the questions they're interested in for operational reasons, for being connected to other organizations at the local level, being connected with funders, anything that they're interested in. You get that you get that sense from them. I think it's all, you have to weigh different things. If you have a wonderful idea, if you have a great idea that you want funded, and you don't have to have all the pieces perfectly put together, you just have to explain in your proposal how you plan to address, some issues you have figured out, some other ones you haven't figured out, but explain the process, how you're going to figure it out.
Really, this project is a cast of thousands, right? This is no way that a single investigator is doing this by themselves. It's just not possible. And right off the bat, actually, I think System for Action, the foundation, was very good about laying the expectations for different domain expertise. And so that was very helpful to at least initially guide our thinking to say, okay, right off the bat, we have this, expectation of being able to speak to these various areas, whether it's in terms of the social service expertise, around public health expertise, around clinical care expertise. And then once we start thinking about that and our specific interventions, then we start mapping on to the matrix of, okay, now we also have some data expertise, and if we're thinking about strategic delivery and how the organizations are going to implement this and use this and think about their overall strategy to connect different organizations. Somebody also has to know about the IT. And so once you just start building out those various components, and that's just, I think, to at the high level, Glenn, the science side, right? I mean, there is a whole kind of building and implementation and working relationships. And as I'm sure you're familiar with, any of this collaborative research, it's a lot of relationship building and trust building with your partners, and then making sure the partners are building and establishing that relationship and trust with themselves. And so there's a large socialization component, there's a large learning X component, there's a large building component. And so it does really take a very comprehensive team of domain expertise, being able to do that leadership component, and the on the ground, data building, data extraction, tool development, those kind of things.
But yeah, I think certainly when you focus on the rigor, and especially when you're not that familiar with the data you're going to be using, sometimes it is very easy to propose something that will prove to be not as feasible. I think in our case in LA County, we're lucky that ELP, this integrated data system, already existed and was available to us because we are county employees. But I can easily see how, having put together an ambitious proposal without having seen the data first, it could easily have backfired. Fortunately, in our case, we were able to do most of what we wanted to do. But I do think it's good advice for other other agencies that are starting to put together a proposal to particularly think about the feasibility, because it's projects as complex as these, it's probably very easy to propose something that very quickly you end up realizing, yeah, we're not going to be able to do that.
So I guess I just wanted to say, I think it's great that the Systems for Action program has this the one-year developmental research grant to allow researchers to sort of figure out this right balance of rigor and feasibility for a full-length research study, because I think that is a common challenge, I would say, in the proposal process, trying to strike that balance without really having full access to the data that you're going to use in the research study, and without having the funding to actually have the stuff properly look into the feasibility of the study based on all the data that you have.
Yes, we used we had a pretty robust strategy for translating our research for action. And that's something that my center does already. We don't carry out any research unless we can actually translate it to policymakers and to the public, who can put the pressure on the policymakers to change things. And we always make sure that we have agency leaders as well, people within TANF or the Agency for Children and Families. Those are really important stakeholders to help with the to help you with your communication strategy. If you're not familiar with how to create a policy brief or talk to the press or to get the press to cover your work, it's important that you potentially build in a communications specialist into the proposal itself. Because a lot of people don't really have that type of expertise. We're able to really focus on our research and then use other aspects of things that we already knew how to do. So I could use some of my team that was not funded through the proposal to help to disseminate. And also you need the agency folks who are not necessarily going to research conferences. You need the people who are running the agencies or who are administrators who don't go to research conferences and who maybe consume research but in a very surfacey way. Having them involved in your strategy as well gives you some terminology to use, and also they have a lot of informal mechanisms for communication that are completely off of the radar of researchers. The best spokespeople for a program or for research are often not the researchers, but the people who are impacted by the research. So that can be agency officials who've worked on merging systems, and also people who have benefited from the systems starting to align. So we really make sure that the people who have been in our programs have opportunities to speak directly to the press. We create videos about their experiences. We create little commercials and things like that, and that helps to also get people's attention.
I always go through a selection criteria, and it tells you there, you know, the each item is bulleted of what the foundation is looking for, or what you know the program is looking for, and then the question. Then you think about it as a question. Are you answering that question? Are you providing each and every single item that they're asking there, or you know, as close as you can? When you write this, give it to folks who read that don't do anything related to it.
Right.
You know, your colleagues, your friends, your family members that are reasonably, they can reasonably read it and understand what you're saying, but that they're not in the same area that you're in. And if they can understand it, then you're on the right track. You know, they can explain back to you, this is what I think you're trying to do. Because many times, you know, we get too close in on what we know, and it's easy to get lost.
We had a lot of conversations up front with both PCSAO, our child welfare partners, our behavioral health partners. They all have local conferences at the regional level, at the state level, where they bring practitioners and executive leaders together all the time that as scholars we might not necessarily, we're not necessarily present at, and that's a missed opportunity to get our research findings, or at least present on them a little bit. So we had a lot of discussions up front about identifying what those opportunities are, figuring out when they happen in the calendar, and what results we might have ready when, to be able to target that to the right audience.
Above and beyond the dissemination through the regular peer-reviewed journals and, you know, conferences, we've also made a pretty conscious commitment to get the word out through channels that are not typically used to tell you about research findings. This includes things like, you know, our 50-year-old MHA program's alumni newsletter that goes to health system executives throughout the region. We have, you know, our Center for Health Policy has these briefs that go out to legislators in the state of Indiana that describes on a one-pager with infographics and non-research speak what our findings are, what they mean to constituents, and what can be done about it from a policy perspective to enable that to be scaled. And some of that involved educating our marketing staff. Some of it involved sort of, frankly, educating the university.
So I think what we wanted to make sure is to make sure to include the stakeholders from the different sectors right from the beginning. So for our proposal, we went out to stakeholders from the different sectors to get their buy-in right from the beginning. We had letters of support for the proposal from WIC, from the local WIC agency, for instance, from several different county agencies for whom the results might be something that may be useful to them, including the Office of Child Protection, which I mentioned before, the Department of Health Services, of course. So at that time, I was at the Department of Public Health, and we also got letters of support from the Chief Information Office, from whom, who is the data steward for the county data. But I think more importantly, we also, in our proposal, we wrote that we will convene an advisory group meeting and a steering committee meeting that will include the stakeholders from MAMAs as well as stakeholders in the county, such as Office of Child Protection, maybe the Justice Department, the executive level at the health agency, who may be using the results of the study, the decision makers. We want to convene them and explain what the study is about. We want to get their input on how can we best present the results of the study so that it's something that can be useful for you as decision makers to act on. Because as you said, this is systems for action, and at the county we also want our results to be used for action. And I think that ties in to why, when we were looking for research topics, we wanted to make sure that these are research topics that ties into the priorities of the county, because we want to make sure that they will be translated into action.
That's another really good question, and it goes back to the tremendous community support that we have received throughout this project. And with our stakeholders and our community participatory approach, we worked with them to develop the budget in terms of what needs to be done, where should the funding go in order to get it done, and how do we best use the resources so that these important multi-sector culture of health questions can be understood and strategies addressed, and especially the mechanisms that will lead to better outcomes.
You always have to keep in mind that element of fairness with your partners, whether you're an academic institution and you're working with another academic institution or somebody in the community. So, and that requires a lot of conversations about what is it that you're asking them, why you're budgeting a given amount, why you cannot increase it or can increase it.
I lost a little bit of sleep over the requirement. The RFA is very, very clear that this is about linking public health, medical services, and social services. And at first I'm like, oh, those are our three partners: our public behavioral health local entity, our substance use treatment organization, which qualifies as a medical service, and then our child welfare agency, which is social service. But then the more I thought about it, the more I started to think, like, maybe those public health authorities are actually social services, or maybe they're medical treatment. I probably overthought that to an extensive degree. And our team talked about that a lot. And actually what it pushed us to do was to be very clear on paper about how we were thinking about those three entities and how that manifested in our context. And I will say that that was one of the points of feedback after the review process, was to justify a little bit more clearly, especially how those public behavioral health authorities were acting as a public health entity. So what I appreciated about that is that it really forced us to be very clear, not just for purposes of grant review and getting the grant award, but then to also think about, when we're talking about some of these public administration or public health strategies that we use to help organize systems, how we can make the case for how that literature is relevant in our scenario too. So that was one of the things that was challenging, but ended up pushing us in a really productive way.
I think what I would do differently is maybe try to do just a little bit less so that my team and I can really focus in on ensuring the success of our specific aims. I think that we thought that we had something that was manageable in the time frame that we had, but as is natural in any research and also any kind of programs, especially when you're dealing with multiple agencies, it takes a long time to get people to build trust and to get aligned, to get meetings together, those kinds of things. So I think I probably would have said that we were going to do a few things, not as many things.
I would have spent, even though I had good partners, I have great partners actually. It's always a good idea to know a lot about the line of work they do and the constraints they face and they don't face and so on. So I think that I guess it's more like I knew what they did because I've worked with them for a while, and I wish I had spent even more time getting to know potential issues. I saw this, actually a good example on this comes from when CMS had the Healthcare Innovation Awards.
Right.
That was a large project that I managed, one of those in the first round several years back. And it took us about 6 months once we got funded to basically get started from what we told CMS we were going to do. And we were not the only ones. Everybody experienced that. And when they did the second round, they made sure that each project had several months to plan before, like, for example, going live and starting serving patients or clients or whatever. In a way, for this, you don't, it's the time is very short. So you have to like do as much of that planning before as possible.
Right.
So I mean, so if I was going to put together a proposal for you again, that would be my first, sort of like, okay, do I know how claims data works from a given? Have I talked to the legal department in this health plan or to the about privacy, and do I get a good sense of how they're going to share the data with me? Do I have an assurance from somebody high enough in the organization that says, yes, we will give you the data for this price or whatever, and in this format?
If you're too ambitious in your proposal, you're going to get hammered on it.
Mm-hmm.
If you're not ambitious enough, you're going to get hammered on it. And so you have to find that happy medium. And at least this was a positive experience with us. There was a lot of back and forth on a couple of the rounds where we got feedback from reviewers, sometimes pushing us to scale up and sometimes pushing us to scale down. Mm-hmm. It wasn't drastic, but it told us that we kind of hit close to the mark, that it didn't require a complete redo in, conceptualizing our solution. But we would spend even more time, I think, in the next round, right-sizing the project so that there's less of that to the best of our ability. And that's not usually what I think someone starting out intuits. They either go too big or too small. They're rarely in the neighborhood.
But I would also put into why right-sizing is so critical is because 2 years goes by really fast. 2 years goes by very quick. And then 2, the other thing is, by nature, these are inter-organizational projects, right? And so you move at the speed of your slowest member, or you've got to bring everybody together. So that right sizing is exceptionally critical, and having every partner on the same page right at the beginning, because you don't have giant room for error in terms of timeline.
Be creative, be innovative. It's really been an eye-opener for me, is just asking the community what their perception is of the issues that we're dealing with, and opening that dialogue has just been an eye-opener for us in terms of the shared definition of the problem, the shared definition of the urgency and the importance of the problem, and the shared commitment to find multi-sector solutions, because it truly is only multi-sector solutions are going to work.
I really think that I might be biased here, but I really think that some of the ideas that emerge from the community are some of the most interesting research questions that you could really pursue in some of these grant mechanisms. This particular Systems for Action program, I think, is really well suited for pursuing those kinds of questions, just because of the emphasis on community engagement. The questions around system alignment are very practical questions, and meets a need in the field. And I think that the earlier that folks can have those conversations with their partners and sort of let the questions emerge from that conversation, I think the easier it will be. Well, it's never easy, but I think the more straightforward and clear the path will be in terms of what are the key research aims, how does this, and how will you translate the information back? It really helps to have an eager audience who wants to know what your results are to their question ahead of time.
I think I would probably emphasize again, especially I suppose if you're not a university, if you're a local government agency or other entities, I think getting the buy-in of people in the leadership position is important. I think for both of us, again, we've picked topics that are priorities for the county, because this ties back also to getting that support during the proposal process, to that challenge that Ricardo mentioned on making sure you have some access to the data in that preliminary stage when you're developing a proposal, to find out if what you're proposing is feasible. Getting buy-in from the leadership at the department level or the county level, I think, is critical to give you, some access, not only to the programmatic people who will help you understand their program and give you this domain expertise that you may need, but also some access to the data, making sure that they will let their staff talk to you and give you whatever information you need to create and craft a strong proposal.
I think of two things I believe are important. One, I think we both touched on it before, is this sort of discovery phase on getting an early look and as complete as possible look at the data that you plan to use, understand very clearly what you can actually do with the data that you expect to have access to. I think that's very, very important to avoid issues with somebody not being able to do what you were supposed to do, what you put in the proposal. That, I think, is definitely critical. The second part, I think, is more in the conceptualization of the study. Systems for Action is very different from most of the funding programs out there. I think it's important to understand what you are looking for. That you want to look at truly multi-sectoral, system-level interventions that that it's not just about, well, let's take a look at a program in this sector and then just see what happens to people in some other sector, and that will meet the requirements of the program. But it goes deeper than that. It has to be something that really touches individuals across multiple sectors and initiatives. I believe that's what the intent is. Initiatives that are truly designed to provide this holistic impact and not just see what happens in them and something else that is totally unrelated. So I think that, to me, is probably critical, to spend some time truly understanding what the program is interested in and making sure that you are exploring an initiative that fits those requirements rather than trying to force just any program into the requirements of Systems for Action. I think that's certainly something that we both try to do, try to make sure that we were looking at initiatives that fit the program really well, that they're by design, they're multisectoral in nature, and I think that it seems like that paid off, right?
Well, I hope that the insight that our successful grantees have shared with you in this virtual workshop has been helpful. Hopefully you've been able to get a better sense for the the breadth of research projects that are supported under the Systems for Action research program. And very importantly, I hope you've gained some insight into strategies that can be successful in developing an application for research support through the Systems for Action research program. In conclusion, I want to highlight a few things to keep in mind, again, as you move forward in developing and submitting your application. First of all, make sure to carefully read and review the funding opportunity brochure that is available, that describes the System for Action research program, and importantly describes the funding priorities that are of primary focus for this most recent call for applications. Every year our focus in the program changes a little bit, and this year there are some specific priorities that we're looking to address, research priorities. They're described in detail in the 10-page funding opportunity brochure. So that's the place to start. Carefully read and review that brochure. Think about these priorities and how they relate to your research idea. Secondly, encourage you to take a look at the larger, more expansive research agenda that has been developed for the Systems for Action program. This research agenda was developed initially in 2015, so about 4 years ago. This agenda has really been the touchstone for the Systems for Action program over the last 4 years. We'll give you a much better sense of, again, the range of topics and the types of evidence that we're trying to produce through this program. And we've recently updated that research agenda, so even if you've looked at it a few years ago, you want to go back and revisit that agenda as part of your application development process. Third, I would encourage you to spend some time on the Systems for Action website. In particular, you can review the array of research projects that have been funded through previous waves of the Systems for Action research program. We have more than 25 studies that have now been selected and funded through the program. Important to look at those projects, get a sense, again, for the range of studies that are already underway, the types of studies that we're looking for, and importantly, how your idea might fit into this existing portfolio of research around how to align health and social services systems. You want to make sure the application you develop is not duplicative of existing studies that are funded through the program, that what you propose is going to be unique and innovative, and value added will be complementary to the other studies that are underway. So those are a few tips I think that would be that we would strongly recommend you take as you move forward with your application. As hopefully you've gained an appreciation for and hearing from some of our more successful grantees, stakeholder engagement lies at the heart of this research program. And so as you begin to develop your application, it's never too early to step out, identify the range of stakeholders in medical care, in public health, and in social service systems that you need to engage in your research project. Engage them early, engage them now at the application development process. They will bring ideas and solutions to the project that will invariably prove valuable during your application process. So start that stakeholder engagement process right now, and stay with those stakeholders through as you develop your application. We're very excited about this next round of funding for the Systems for Action research program. Our program continues to grow and expand, and we're beginning to have real-world impact on aligning medical, social, and public health systems. But we need your new ideas. We need the innovations that you can bring into our program as well. Thank you again for being with us as part of this virtual workshop. We encourage your applications. We look forward to hearing from you.